So let's talk about like a good, simple skincare routine that you would recommend for somebody.
Yeah, so many people, they go to Ulta, they go to Sephora, they go to the local department store, and it's super confusing what to do on your skin. And there's even people who are recommending 10, 12-step skincare routines. The first thing you want to consider, you can do a very basic skincare routine. And for people who, let's say, are watching or they're listening to this right now and they're saying, geez, I don't like my skincare routine. My skin doesn't look good. It's inflamed. The first thing I recommend people do is get back to the basics. The answer, if you've got issues with your skin, if you've got breakouts, if you've got inflammation, if you've got unwanted redness, the first step is not to figure out what cream to add, because oftentimes the number of creams that you're using on your skin can actually be the problem and why your skin is reacting that way. So what I usually recommend is get back to the basics of a basic healthy skincare routine. And this is something that we actually tested on people. And we found that after 2 months, people starting out with quote unquote average skin looked an average about 5 years younger after just 2 months of doing this very simple routine. So every morning you cleanse your skin with a cleanser appropriate for your skin type. So if you've got, let's say, oily skin, then a more foaming cleanser is better for that. If you've got dry skin or sensitive skin, then look for a more hydrating or a milky cleanser. Then I recommend an antioxidant like vitamin C, a serum, like a vitamin C serum. Bonus if you add vitamin E to it. There are studies that show that vitamin C and E, when they're added together, can have a synergistic antioxidant effect. And then I do recommend, if you're going to be out, to consider putting on a sunscreen, at least SPF 30. And I know there's a lot of discussion on sunscreen. We could talk about that if you want. And what I feel is a very prudent, reasonable way to approach sunscreen. But I do recommend, especially if you're going to be out, then at least SPF 30. That's what the American Academy of Dermatology recommends. That's all you have to do in the morning. And if that's all you do, that is fine. In the evening, super important. If you only cleanse your skin once a day, you got to do it in the evening. You got to get rid of the day's worth of dirt, grime, pollution. You got to get rid of your makeup. You got to let your skin basically breathe at night. After that, I do recommend an anti-aging cream. The one that we usually recommend is retinol. That's a good starting point. Retinol is derivative of vitamin A. It's probably the most scientifically proven of all the anti-aging creams out there. It can help to thicken the collagen of the skin. It can help to lighten spots. It can smooth fine lines. It can exfoliate the skin. And in some people, especially if you use more of the prescription strength tretinoin, if you have a history of skin cancer on your face, it can reverse early pre-skin cancers as well. So a lot that it can do. So that's all you do at night. You cleanse your skin, you apply a retinol, and then if you want to throw a moisturizer on top of that, you can, but you don't have to. If you've got oily skin, and let's say you're living in New Orleans in the summer, you don't have to add a moisturizer if you don't want. If you've got drier skin, and let's say you're living in New York City and it's February, then moisturizer may be good. And then what I do recommend is once a week if you've got sensitive skin, twice a week if you've got quote unquote normal skin, to exfoliate. You can do that with a gentle scrub, like a physical scrub, or you can do that with like an alpha hydroxy acid peel. And that's it. It takes about 2 minutes a day. If you do that simple skincare routine, you're going to be ahead of 98% of the population.
Yeah, there's a couple of things in there that I certainly agree with, and there's a couple of things that I'd push back on. For
Yeah.
one, I've noticed since I started exfoliating, which was several years ago, my wife actually turned me on to that. As a single man,
Yeah.
it's like I never thought about exfoliating, right?
Yeah. Yeah.
Then, in my mid 30s, she was like, you should really try this. And I started doing it and I actually felt like I'll exfoliate typically after I shave my face, which is
Hmm.
usually 3 times a week or so.
Yep.
And I actually just feel cleaner. I feel better,
Hmm.
right? I mean, it helps remove waste and microbial waste and things like that. And I just feel better. Like I feel cleaner. I feel more fresh and energized.
Hmm.
And so I think exfoliating, I think is a really great idea, like you were talking about. And there's different types of exfoliators. I use more of kind of a physical one, like a almost like a sand one, right? And I also
Yeah.
put a lot of antioxidant creams on my skin now. There's a lot of obviously moisturizers and creams out there, and I know you talk about it in your book. You didn't really touch on it here, but I know you would agree. There's a lot of chemicals, a lot of toxins,
Yeah.
parabens,
Yeah.
phthalates. I mean,
Yeah.
many people, particularly women, are putting on just massive amounts of pro-inflammatory chemicals that are throwing off their hormones on their body because they,
Yeah.
want to put on the cleanser, the moisturizer, things like that. And I think that's a really important caveat.
Yeah, there is a term called clean beauty, which I try to
Yeah.
point people towards. Clean beauty, unfortunately, is kind of in skincare the equivalent of organic. Like it can be bastardized and used
Right.
inappropriately. But in general, clean beauty is the idea that you're going to use clean ingredients that are not potential hormone disruptors. They may not be potentially carcinogenic. There are a couple of places that you can go to research the products that you use. Environmental Working Group has a website called Skin Deep. And so if you're wondering like what these chemicals may potentially do with your hormones, with your body, take a look at that. There's also an app called Think Dirty. Make sure it's the Think Dirty app because I'm sure there are other apps that have similar names you don't want to
Mm,
download on
yeah.
your phone.
True.
But the Think Dirty app, basically, it even has a UPC camera where you can go to, let's say, your local drugstore. You put the UPC in, and then it will bring up the product and how clean technically it is. So I'm all for clean beauty products, and so, but at the same time, the argument in traditional medicine is that, oh, well, if you apply this product and it does have, let's say, this formaldehyde releasing substance in it, in the percentage that it's in, it's not going to affect you. And that's always the argument. But the problem that they're not addressing is the complete toxic load that you get from all of the other sources of potentially harmful ingredients in your food, in your cleaning products, in your hair products, and all the other stuff that you're exposed to. There's no way to really combine all that and test
No.
it on people. And so I agree with you. I think the main thing is you want to reduce your toxic load by trying to stick with clean beauty. The problem is there isn't any designation that is a proven designation for products that, like, if you look for the seal, you're fine. You do have to do a little bit of your own homework, unfortunately. But clean beauty is a simple way to start.
Yeah, for sure. I mean, I'm a huge advocate, like with nutrition, we talk about maximizing nutrients and minimizing
Mhm.
toxins, right? You want food with the
Yeah.
maximal nutrients, minimal toxins. So same with your skincare. You want to look for skincare products that have a lot of these, in a sense, it's not that you would eat it, but it should be something because it's going to get into your bloodstream transdermally through the skin. So it should be something that you technically could eat, right? Like, and so you'll see a lot of plant-based ingredients in there, things that you could normally consume, herbs, things like green tea extract. You might have resveratrol. You might have, all different types of things. Maple leaf extract, I know is one for the skin. So there's all these different things that have antioxidants that, theoretically we could eat or make teas out of that we're making moisturizers and creams, and those can be really positive for our health and for our skin health particularly.
Agree. You definitely want to look at the labels, and like I said, those two websites, the website and the app, I think are great
Yeah.
ways for people who are lay people who don't really know, like, geez, what are all these chemicals? And yes, ideally, when you look at the ingredients, ideally you should see a lot of natural products in those ingredients. You should see a lot of different oils. There's a lot of very healthy oils that can be
Mm,
put into those, a lot of extracts from different botanicals that can be
yeah.
very healthy. If it's just a ton of scientific sounding names,
Yeah.
then you definitely want to look those up because, yes, there's a possibility that some of those could be preservatives that may not be necessary. And then there's a whole thing of fragrance. Fragrance is
Yeah.
very simple because they'll just put fragrance and you don't know what is in that fragrance. Fragrance can definitely be very irritating to the skin.
For sure, for sure. And then the area of the skincare that I would certainly not agree with would be sunscreen. Now, I'm also not a fan of being sunburnt, right? I don't think that's
Yes.
healthy for anybody to get sunburnt. However, I believe that healthy sun exposure is actually one of the best things you could be doing for your overall health and for your skin. Now, obviously, there's some oxidative stress that's produced when we're exposed to UV light.
Mhm.
But if our body, when I think about it, it's like if there's not already a fire going on in our body because we are, eating bad food, living a bad lifestyle, if we're eating a healthy diet, living a healthy lifestyle, like a lot of the principles you teach in your book, then that sun is a hormetic stressor that can actually make our skin cells stronger, more stress resilient, healthier in general. Plus, we're getting the vitamin D, we're being exposed to infrared, to red light, right? Depending on the time of day. And so we're getting mitochondrial optimization there, improved mitochondrial energy production. So I'm a huge advocate of getting regular healthy sun exposure without the sunscreen. So what's your thoughts on that?
I think there's a reasonable middle ground that reasonable people like you and I who can see both sides can come
Mhm.
to. So, I'm a plastic surgeon. I have patients who come in to see me and they have skin cancer on their face. And I tell you, David, you do not want skin cancer on your face. I have patients who come to see me. They have a lesion on their nose. It's not just not healing. The first sign of, let's say, a skin cancer is a wound that just doesn't heal. It keeps crusting over. It keeps crusting over. And oftentimes that's a sign of a basal cell carcinoma. Now, basal cell carcinomas are not melanomas. They're very unlikely to metastasize and kill you or anything. But what they do is they just keep growing bigger and bigger and bigger and destroying whatever tissue is in their path. And so I do get patients who come to see me, and usually it's, people our age usually are pretty good with not getting burnt and stuff like that. But in their 20s and their teens, when we were back that age, we did. And so a lot of the damage I'm seeing now is damage that was done from before because they've been taking good care of their skin. And they come in, there's this lesion here, and then they go to a dermatologist and they come back to see me, and half their nostril is gone, or part of their eyelid is gone and it's pulling down. There's a lot of really disfiguring, horrible things that can happen. You do not want skin cancer of your face. However, I also understand that there's so much benefit that you can get from the sun. So I'm not a dermatologist who wakes up in the morning, slathers on sunscreen, and I'm sitting in a basement all day wearing sunscreen. I think that there is a reasonable middle ground that you can get where, in the early portions of the day, in the later portions of the day, you go out there, you get your sun, you get your circadian rhythms going the right way. And when you are out and you're going to get a good amount of sun, especially in your children, and especially in people who have lighter skin, you do want to protect it, because I hear you with there's benefits there, but there also is damage that can occur. And that damage, you don't necessarily want to throw the dice and find out later, 20 years later, that, oh, you know what, maybe I wasn't eating as healthy of a diet as I thought. Maybe my antioxidants, even though they can provide some level of protection, they're not providing enough. And I've got this Goomba growing on my nose or my face. So I think that there's a reasonable middle ground there. I think it's a combination of everything. I don't agree with dermatologists who don't say anything about the diet, but they say, oh, sunscreen, sunscreen, sunscreen. But I also don't agree with some of our alternative health friends who basically just say, you don't need sunscreen. All you need to do is get rid of your seed oils and your skin will protect itself. Like, I don't want to take that risk when you see the types of damage that I have seen in my practice. So I think that there's a middle ground there,
I can relate with that.
And sunscreens, there's better ones and there's not as good ones too out there. So I think that's the key.